An advanced paramedic practitioner is a clinician who's done 3 years of a master's, so after they've completed their undergraduate qualification to become a paramedic, they then go on and do a 3-year master's in advanced clinical practice, where they undertake the 4 pillars of advanced clinical practice. That grounding gives them the ability to be able to take on enhanced clinical assessment, have a different level of risk threshold and stratification, and to enable clinical decision making to support patients to stay well at home. The looming crisis and the problem that we have at the moment is extensive hospital delays outside of our ED departments. When we educate people to advanced practice level, they are able to better understand how to manage complexity, frailty, comorbidities and polypharmacy, for example.
So we're in West End Medical Centre, which is one of the health board-led practices within Betsy Calder, and I work here 1 day a week as an advanced paramedic practitioner. As paramedics, we're very good at assessing and taking a history, but we don't always know the answer of how we can manage or best manage that patient in the community, and when they actually do need to be escalated into the emergency department or secondary care. So I am refining all of that skill set whilst I'm here, and also sharing my knowledge of WASUT with the staff here in the surgery. So how do they best use the 999 system, or what do they do in an emergency, or how do they get their patient from their home into the hospital using the right method of WASUT transport. So the idea with these rotations is that I work within this community here in primary care, but then I work my WASUT operational shifts within the same community. So those very complex home visiting patients that we see presenting to the 999 system are also presenting here. So I'm aware of their medical history because I see them for the GP surgery, but when they do present in the 999 system, I know how their surgery works, but I also know that patient's history and how best to manage them.
We're part of a group that triage 999 calls. They aid with remote clinical decision making, rapid clinical screening. They can also direct their colleagues who are out on the road if they're remotely to cases that are appropriate for them to go and manage. We have pathways to avoid A&E, and we have pathways to directly admit onto the wards if it's appropriate. But likewise, we also have community pathways where clinical resource teams like physios, occupational therapists can get involved and help that patient stay at home. And like I said, that then comes back to not taking the patients to A&E who really could be helped elsewhere, really.
We know if we send a traditional paramedic to a job, their conveyance into hospital typically sits around 55 to 65%. When we send an advanced practitioner, advanced paramedic to those jobs, it typically sits around 25 to 35%. And that's across all code sets. So we're finding that advanced practice will really help change the dial on actually understanding exactly what the patient needs and effectively navigate them around that system.